Welcome back to Series 1, Episode 2 of What Everyone Should Know About Health. I'm with my good friend, Dr. Elizabeth Hughes, again today. Good afternoon, Elizabeth.
Hello. Good morning from my world.
We said that today we would extend on from our last conversation, really about what people can do to protect themselves. These early series are all about getting enough information out there that people can start doing things immediately. We know that in the following videos from this, we're going to be talking about how you can quickly build up your immune system. And furthermore, something that most people probably are not familiar with, resetting your circadian rhythm. But for today, Elizabeth, there's three questions that I have for you, which I think will be quite helpful to people. The big question out there at the moment is, can you vaccinate to protect yourself? And I won't say against COVID-19, against any virus. And the other two big topics of conversation are, should I be wearing a mask and should I be wearing gloves? So let's go back to question number one. As we've said earlier, we're going to be talking in great detail about vaccines, but can you vaccinate against any virus and COVID-19?
Oh, okay. Great questions. I love those. So can you vaccinate against any virus? And the answer to that is yes, against very specific viruses. Smallpox vaccination is an example of a vaccination against a virus that has worked, and there's no smallpox occurring naturally in the world now. But smallpox has some characteristics to that virus that make it easier to vaccinate against. There are many other viruses for which there is no effective long-term vaccination or no effective vaccination. And there is a question of whether or not every virus needs to be vaccinated against. And I believe no, we have natural immunity to either avoid infection with a virus or suppress the symptoms so that it is mild. So the big question is, can you vaccinate against a virus? Yes, certain ones. Is it universally effective? No. There are lots of vaccines that don't work as you think. And should you? No, I don't think so. And I want to make one really specific comment about the current coronavirus and the question of vaccinating against that virus. I'm not 100% sure that it is necessary to vaccinate people against a virus where the majority of people are asymptomatic or have mild illness. It doesn't make a lot of sense to me. And when you look at the figures that are coming out now of what's the actual amount of immunity that is built, and you only build immunity when you've been exposed, it's very, very high. The number of symptomatic cases is very tiny. So when you really look at the facts and figures, it turns out that this is not this everybody gets sick, everybody gets deathly sick situation that everyone believes in. The second thing I want to say really specifically about vaccinating against this coronavirus is there is a growing number of children who have antibodies to the coronavirus, who are having a multi-system inflammatory disorder. I don't know if that's happening in the UK, Glenn, but here in the United States, we're seeing children who are having a sort of devastating immune system disorder or immune system dysregulation, where kids are getting really, really sick who were previously well. And I'm lucky. One of my neighbors who lives down the street is an intensive care doctor at the Seattle Children's Hospital, where he cares for the sickest of the sick children. In the ICU, in the intensive care unit where he works, every child with this syndrome has antibodies to the coronavirus. They're not symptomatic with the coronavirus. They're not testing positive for having viral particles. They have the antibodies, which means they were exposed and they mounted an immune response to it, but they're not sick with antibodies. And my worry is if we vaccinate people and intentionally develop high levels of antibodies artificially, what is the relationship to children getting this syndrome? Is there something about developing high levels of antibodies that actually causes problems within the body? And I know in later videos, we're going to talk about cytokine storm. Yeah. So my concern really about this vaccination would be, yes, is the treatment going to be worse than the disease? Is invoking high levels of antibodies going to predispose people to have a post-vaccination syndrome when they get enough antibodies? And I think it's a good question. It's something we need to think about.
Yeah, again, I know that it sounds that I keep referring to the fact that we're going to talk in greater detail at later stages. We are. Vaccines is clearly a topic of major conversation at this moment in time for so many various reasons. And, you know, my biggest concern, there's two concerns really. Number one, should we be vaccinating children at such an early age when they've not even built up a natural immune system? And secondly, let's call it the additional contents within vaccines. But again, this is something that we need to discuss in great detail. You mentioned a subject today regarding, obviously, what are the severe symptoms and causes of any virus. I just want to make a clear statement today. People will die. People will die, whether it's of coronavirus or COVID-19 or the flu or other illnesses as well. You know, sort of, there isn't a vaccine that can save the world. People will always die. And, you know, I don't have a problem in discussing that conversation. A couple of other things we want to talk about in future videos is obviously herd immunity and the effects of lockdown, the effects of social distancing. But just to wrap up for today then, Elizabeth, those two other questions regarding what people can do to help themselves. Should anyone be wearing a mask, unless they're obviously in open heart surgery? And should anyone be wearing gloves, probably in the same environment within a surgery? The general public, what's your thoughts on that? I have my opinion, but I'm sure we're going to come to the same conclusion.
Right. Yes, absolutely. So masks, as they are being advised, just wear something to cover your face, is not effective. I mean, I really hate to say it, it's not effective. And there's lots of studies from material scientists. There are studies from virology labs. People are coming to it from different ways. The typical, so here, I actually have props today. So this is the N95, the mask that will block the particles, the tiny, tiny particles. These have to be fitted. They have to completely cover your face, and they have to be the only way you get air in and out of your body. These are, this is effective, but remember that they're only going to block 95% of the particles that are coming in. So if you wear one of these all day, every day, all the time, you're going to get a reservoir of particles that are trapped on the outside that you can gradually inhale. I believe that these masks used over the long term, as you know, an individual mask used over the long term does not end up providing a lot of protection to you. These masks used single use, used and thrown away, that's the way to do it. But that's not what people are being asked to do. I have a good old surgical mask. Now, I'm pro surgical masks. I've hundreds of thousands of hours behind a surgical mask doing procedures. But these masks are designed really to protect patients if a doctor happens to sneeze or cough or burp or drool or something happens during a procedure, when, as you know, in the middle of a procedure, you can't stop and blow your nose or wipe your nose. This is what protects it. These are designed for big particles, globs of phlegm, sorry to be disgusting, but that's what these are designed to do.
Yep.
What I see people using these though is wearing them down here, wearing them over the mouth, and they're not going to block much airflow. And there was a very, very interesting study where people were with COVID-19 were given these masks, and then they were tested afterwards to see where the viral particles were. And people who had coronavirus, they found there were more virus particles on the outside of the mask than on the inside of the mask after wearing it for a few hours. So I believe that these masks are more permeable than we realize. And then you get, I love this sort of a bandana, and that's a fashion statement. And if that's something you'd like to do in order to show solidarity, show your concern, that's fine. But to think that that's going to have a real effect in stopping transmission of a virus is a little like thinking that there's a pink ribbon breast cancer that people will often pin to their clothes. That's about as useful for preventing breast cancer. I don't believe that wearing masks, and especially if you are outside in nature, if you're walking your dog, there is no purpose unless you're in a place where there's a high likelihood that you could be exposed, in a hospital, in a doctor's office. Those are where you need them. But the rest of us, masks do very little for us. And to think that they're doing more than that is sort of foolish, honestly.
I think you've been very polite there. If I could retort in typical Yorkshireman style, people, if you believe that walking down the woods, walking your dog, or having a walk down the high street, if you think that wearing a mask is doing you any favors, categorically I can state it is not. It is probably actually having an adverse effect on you. If rather than being out in the fresh air and breathing in the much needed oxygen that you need, particularly during difficult times when you're probably stressed, you need as much fresh air as you possibly can. The last thing you need to be doing is almost causing a form of embarrassment to yourself, in that, you are the sort of a person that's afraid that you may catch something in the fresh air, whilst really what you're doing is probably breathing in your own carbon dioxide. So I think, in conclusion, please people, stop wearing masks unless you are a surgeon that is actually operating within a procedure. It's not going to do you any good at all. And finally for today then, similar sort of situation regarding gloves. Is there really any point in wearing gloves at all?
No.
Yeah. Can we just leave that as a no? Because there clearly isn't. You probably actually, if you did get a virus on your hands, you're probably more likely to pass it on by wearing gloves.
Yes.
So stop wearing masks, stop wearing gloves. Thanks for today, Elizabeth. See you in the next one.
Bye-bye.
Thanks. Bye-bye for now.